So here we have a simple plantar wart on the plantar aspects of this gentleman's left toe. I've marked it, as you can see, and now I'm going to disinfect the area and inject some local anaesthetic. Now unfortunately this is the tender part, so bear with me, yeah? Okay, it's going to be a small scratch. I'm going to use some plain lidocaine. Just going under the skin, sorry sir, and then I'm injecting that nice and so, sorry. Okay, and I'm going to give that a couple of minutes to work. Is that okay? No, not too bad, okay. Test the area. Is that sharp? Sharp there? No? Okay. Any pain, let me know. So simply excise the area as marked along the edges. That's the one edge, and now coming along the top edge. Got to make sure you get the entire wart out to reduce the chance of any pain. No, to reduce the chance of it coming back. There's always a slight risk of recurrence, but that's generally proportional to the margin, to the big margin. There's a less chance of these things, troublesome things coming back, which is obviously what we want. Okay, so that's now all done. Now the viruses that are responsible for these lesions generally live in the deep layer of the skin. So it's really important to get a full thickness excision and not shy away from going deep. So you've got to go right the way down to the deep layer until you get through the skin into the subcutaneous layers of the foot, which can be very deep on the sole of the foot. Because the skin here is really thick, obviously to allow us to walk around for our lifetimes without our soles breaking down. And there we go, you can see I'm now removing the entire wart. It's cut out and hopefully will not be causing this patient any more problems in the future. I'm going to simply stop the bleeding with cautery. So we use a hyflocated device, very simple, very precise, and it applies heat to the tissues that stops the bleeding. What I'm doing now. And you can see that it is now. So do you want to come in now and just show, so where there was a verruca or wart, there's now a hole in the foot, which I'll stitch up.